healthcare providers pay close attention to the activities and pronouncements of the Office of Inspector General. The OIG's mission to prevent, detect, and correct fraud, waste, and abuse should be aligned with the goals of an effective compliance program.
Hello everyone, my name is Cesar Landeros. I'm the Vice President of Operations for Skill Wound Care. In today's environment of healthcare reform and the implementation of the Affordable Care Act, we are faced with a number of changes to the requirements of documentation, medical necessity, and the way that we do our billing. It is imperative on the area of compliance. Compliance plays a very significant role in our ability to succeed in the upcoming years. You will view various legislators speaking about compliance and some of the tools that they are implementing affecting all medical practices in the healthcare industry. Pay close attention to everything that you will be learning in these training sessions and ensure that you do your part so that we all succeed together.
We are here to announce the results of the largest federal healthcare fraud takedown in our nation's history. 94 people in 5 cities have been charged for their participation in schemes to submit more than $251 million in false Medicare claims. Those charged today include physicians, they include medical assistants, they include healthcare owners and executives. According to the indictments, these defendants participated in schemes to submit claims to Medicare for treatments that were not medically necessary and oftentimes were never provided. By improperly billing Medicare for more than $1.85 billion, these criminals have siphoned resources from the most vulnerable among us. With today's arrest, we're putting would-be criminals on notice. Healthcare fraud is no longer a safe bet.
It's harder to submit false claims. If you do, you're more likely to get caught, and when you get caught, you're going to pay a higher price. So we're in the process of setting up a data universe where we can monitor real-time billing activities and spot errant billing. We have now in place the tools to stop payments before the money goes out the door, so that if we suspect criminal activity, we actually don't pay the provider. The new Affordable Care Act gives us additional tools, frankly, that we didn't have before. We're just talking today about ways that we could even begin to target some addresses. If we know that this is a notorious address, that maybe some pre-screening at the outset. We're using all the tools we have, looking at the data, finding aberrant billing behavior, pre-screening folks and enhancing the penalty and going after them in the long run.
The intention of the new act and this enforcement effort is to put people in jail who do these kinds of things, to hammer people, so that if you engage in this kind of fraud, it's not simply going to be you're going to pay some money and maybe work your way out of this thing. Our intention is to find people and to put them in jail and to make that a deterrent for people to understand that if you engage in this, if you steal in essence from the American people, among the most vital of programs, you will go to jail. That is the message.
Healthcare in America is facing unprecedented challenges. While providers struggle to understand the impact of healthcare reform, the cost continues to soar, as does the number of people who rely on Medicare and Medicaid. In preparing for the future of healthcare, organizations need to consider compliance as an integral part of their business operations.
As a result of healthcare reform and the focus that it places on value and quality of healthcare, that the compliance operation becomes really an integral part of the health and welfare of the entire enterprise.
It is imperative that compliance is at the forefront of everything that we do. Compliance will play a very big role in our ability to collect on all the services that we render. We will be talking about what are those tools, how they will be initiating those tools or already implementing those tools in recoupment or holding of Medicare claim reimbursement, and how some of these things will be affecting us. All of these changes are not just affecting skilled wound care. They will be affecting medical practice throughout the entire country. It is important that you listen carefully, that you pay close attention, and that you make the adjustments that you need to make in order for all of us to succeed together.